Welcome to the Health to 10 podcast. As PCPs, we send out our patients to consultants for specialized care. Over the last couple of years, we've had a consistent patient favorite. People come back and they always have a lot of praise for her. This is a talented gynecologist, Dr. Schaefer. Dr. Schaefer, thank you for taking out the time with us today.
Thank you. Thanks so much for inviting me.
So I know we've interacted over with patient care and things like that, but for our audience, I wanted to see if you could give us a little idea about your background, where you've trained, and what you did at
And thank you for the nice compliment.
Oh, absolutely.
You didn't tell me that one earlier, so but we do see lots of your patients, and I love they're lovely people. So thank you.
That's awesome. Thank you for your care for them.
So I'm originally from San Antonio, native, born and raised. I went to medical school in Dallas at UT Southwestern, and then returned home for residency here in San Antonio.
Awesome.
So I looked all around, and this was honestly the best training program, best fit for me and my family.
Perfect. So within the scope of gynecology, is there a specific area of interest for you, or do you do the whole 9 yards?
I definitely do the breadth of obstetrics and gynecology. I think many OB-GYNs will say that that's what drew us into the field is we get to follow our patients over the scope of their lives through happy times building their families, but emotional times as well. So I mean, we get really close with our patients. I almost said family. But aside from the obvious obstetrics with gynecology, I have an interest in incontinence. I am really loving trying to build that part of my offering of care to patients because it's just so satisfying. One or a couple of procedures that I've added in the past few years is a procedure called Bulkamid. So this is a periurethral bulking. So when I'm trying to describe it to a patient, this is for stress incontinence, cough, laugh, sneeze, leaking. And if you inject, it's kind of like filler for your lip, but it's injected in the urethra. So it helps keep that urethra closed against stress. And the data is showing that it's effective for longer than lip filler for at least 7 years. And there's zero downtime, no worries about mesh erosion. Patients can go back to doing their thing the same day. So that's amazing.
That's
just like 4 to 6 weeks.
It is a frequent occurrence. It is something that women, especially who've had more than one child, start to experience, especially as they go later in life. So is there a certain age cutoff for this procedure, or is that something that can be offered to anyone?
No, it can be offered to anyone. And it goes hand in hand. There's different types of incontinence. And I think that's something that a lot of patients don't necessarily understand until it's explained to them, and then they pay more attention to it, because you can have that type of stress leakage, but you can have urgency or the overactive bladder where you're someone who knows where every bathroom in every store is. And has to pull over all the time whenever you're traveling with your family. And sometimes you can have mixed. You can definitely have both. So the other offerings, there's a lot of offerings for the overactive bladder. There's medications for both types. There's pelvic floor therapy that can be very helpful. And then there's more advanced therapies, something called sacroneuromodulation, which has been really exciting to offer patients. I had a patient a couple of years ago that it just is a perfect example of why I love what I do. She came to me, was referred to me, possibly by you guys, for something completely unrelated. She wanted her tubes tied. And just in the course of speaking to her and then doing an exam, I noticed that, and of course, this woman wanting her tubes tied, she was childbearing age, so younger woman. She was wearing disposable underwear. So that was kind of a clue for me, like, oh, are you having problems with continence? And sure, come to find out, she's leaking all the time. She is wearing diapers all day, every day, and even uses disposable sheets at bedtime. So a major problem. And she had no idea. She'd never talked to anybody about it.
People have that issue and then just assume that it's a consequence of childbirth, or like they've had 5 kids and that's just how life's supposed to be after that.
And you don't have to live with the misery. And I've had patients. This patient, she went from that to, after having these procedures done, completely dry.
Oh, that's awesome.
Didn't even have to wear a pad. It's amazing.
In general, what's the success rate with these procedures, and how well do people, patients do after that's done?
I would say the vast majority of my patients have gone from at least however severe they were to 50% or better. I like to give them reasonable expectations, but I mean, this is life changing, and that's what makes me so excited about it. Because it's fun when you hear somebody say that, "Oh my gosh, I get to leave the house and I don't smell like urine." Is a big thing.
It's definitely life changing, and the impact on the quality of life this can have, especially for an issue that is often neglected or not talked about, especially if you're younger.
Yes,
that's fantastic.
And I did a patient up to almost 90 years old, and she with the sacral neuromodulation, it's actually a two-part. So I'll frequently, if they have mixed incontinence, I'll do the Bulkamid at the same time as the trial. And the trial lasts for a few days. Like you'll do it on a Thursday, you'll come see me in clinic on Monday, and we'll remove the little transmitter. And so it's kind of nice because if you're mixed, then you can see together what the full effect will be. But then once the trial is removed, you still have the Bulkamid for stress in place. And so I did have one patient who didn't notice a big enough difference when the trial had ended that she was really satisfied with the stress, the Bulkamid. And so we kind of realized that for her, what seemed like an overactive bladder, we think really was her being so fearful of leaking with the stress that she constantly needed to keep her bladder empty. Sure. Whereas this other, once, if you're truly a candidate for both, once the trial is over, you'll notice a lot of your symptoms return, and you can't wait to schedule the full implant. And so, I've had a couple of patients who were planning vacations and they were going to do the full implant after, but they're like, "Can you please? I'm about to go on a cruise." And I did everything I could to make sure that they could have the best time possible.
That's lovely. I love that.
And it also helps with fecal incontinence as well. Which, I've had patients that suffer from that in both. I mean,
in general, like pelvic floor disease, it'll start to affect both things once it starts to get to a certain point. So that's great. And so how long have you been doing these procedures at this point?
About 3 years now.
Okay, that's awesome. In general, because you all see women starting at a really young age and going all the way up to 90-year-olds. For reproductive health, as a gynecologist, what are your top tips?
Top tips. I see a lot of women that'll come in for the annual exam, and I guess a few things. You don't necessarily need a pap smear every single year. The annual exam, I like to educate them, is like a time for preventative care, and so we have a much longer checklist than that. So they may take for granted that I'm talking about and educating and making sure that they're doing all of the things they need to live a healthy life. And a lot of times, and I guess we can get into it more later, but for many young women, I function as kind of their primary care doctor. And natural fit during pregnancy and then thereather until they get more complicated medical issues. And, they definitely see you. So another thing though is like to allow the best care for you, we should probably allow that preventative care to be that and not try to fit every single problem
in that visit,
because otherwise I can't give you the best care that you need. It's great to identify those, but then like come back and see me so that I can really focus on it for you. I guess a few other things is with contraception care. I mean, we have a huge menu of different options for women. And so I really like to not take a one-size-fits-all approach. And so some women, I think, are a little fearful of different options depending on what they are. And so I like to educate them about it. But I think a lot of what I hear is, for instance, with IUDs, a lot of fear about placement. And so I can't tell you how much TikTok has sometimes gotten in the way.
For sure.
Of having a good conversation with my patients. They'll come in terrified about something and they're afraid it'll hurt. I always let them know that exactly how the procedure will be, and that most of my patients, I ask every single one after I do it, what would you rate the pain? And most say a 3 out of 10.
And most would be worried about pain as being the biggest reason why they don't want to get it. And those are options that are maybe less than ideal for them. There's a lot of undoing of TikTok that one has to do these days. When you see these patients.
But to be fair, I mean, a lot of the people on TikTok are railing against doctors not caring about them. And I use lidocaine and like pain relieving measures for my patients. And so if your doctor isn't offering you those things and isn't treating you humanely, then maybe get another doctor.
Absolutely. And generally speaking, the certainty with the contraception, the duration with these devices, and all the other benefits are pretty substantial as well. Like you mentioned,
Yes.
it's not one size fits all, so it's
Right.
not that everybody needs an IUD. But I mean, many could get them, and
Yeah.
there has to be a good reason why not to. So being able to see you get that education, at least give you time to make that determination of what's appropriate, what is likeliest to
Right.
benefit most, would make sense.
Well, but and again, I want what my patient wants.
Yeah.
I just want to make sure that they're counseled because not every woman wants something highly effective.
Oh, yeah.
They may want to plan to just, the fertility awareness method, and that's fine with me as long as we talk about and have a discussion of awareness of the failure rates, and if you're comfortable with that,
Yeah.
then by all means,
Yeah.
it's your life. I just want to help you live your best
Yeah.
life.
And I'd echo that same sentiment on patients that are generally more proactive with their care, where you're not seeing them that one visit a year,
Mhm.
generally tend to have better overall health outcomes because they're more
Yes.
proactive. You have more opportunities to not only identify, but generally just counsel, right? Talk about nutrition, talk about general wellness. On your end, if we're talking about women's health, there's so many different things that it would be impossible to squeeze them into one visit.
Yes.
So for someone who is in good health and has established with you, what is a general recommendation? Now, again, I can see there is variance within that, but what would be a general recommendation on a frequency of visit to be coming in and seeing you folks?
So I would an annual visit.
Okay.
I think is good. I know that after 65, often Medicare doesn't necessarily cover except for every 2 years, and
Yeah.
so in some cases that can be okay. But also important to remember if we're treating you for something, like you're usually allowed to see us more frequently.
Oh yeah, for sure. And then I guess to go back to that, an annual visit, not wait for your PAPs necessarily to come and see your gynecologist.
Exactly.
Even though you're not getting a PAP, there's stuff that still needs addressing,
Yes.
and it's best to do that. And
Yeah.
I love that you mentioned you all are PCPs in your own right because there is a definite management of gynecological issues or obstetrics, right, while they're pregnant. But then there's a lot of peri-pregnancy care that happens that you all do a lot more of. As a PCP in that phase, we're sort of hands off and we're like, hey, what does your gynecologist say, right? Have you seen them? There's recommendations on so many different things with antihypertensives and things like that where we can liaison with them. But ideally, I feel like a lot of y'all sort of drive that in that phase.
I try not to drive too much,
Yeah.
like hypertension guidelines and etc. I mean, I have the basics for OB, but medicine moves really fast.
Oh yeah. Oh yeah.
And I don't want to claim to be the expert. And so I, by all means, encourage them to see primary care because I want them to have the best, most up to date health guidelines and practice for them.
Perfect. So, sort of along the same lines, you talked about TikTok, which again brings some value, also brings some noise. What are the most common myths and misinformations that come into office every day to you?
Misinformation. So I guess oftentimes they may think that certain contraception methods will interfere with fertility or cause a lot of weight gain, which as a general population level, that often isn't true. Certain contraception methods definitely can have side effects, but it might be tailored to the individual.
Yeah.
So I think it's important to discuss the pros and cons and consider trying something because it's not permanent. It's something very reversible. Although I will say, and again, this is just my personal opinion. One example is Depo-Provera is the injection you can get every 3 months. And I remember in medical school that it was very much pushed on women a lot, especially a lot of teen moms. We would try to give them an injection of Depo before they even left the hospital. Well, Depo-Provera, some women love it and it works very well for them. But for some women, they do have a lot of side effects and serious side effects. It could cause depression. Well, a teen mom is at extremely high risk of postpartum depression. And so I don't really see the benefit of giving something that will only last 3 months and they may have an unplanned pregnancy again, but might have a depression. And so I tell my patients, I like us to be in control of the helm of the ship. So that we can turn it around if something's going bad. So if someone knows that they like it, it is your body, your choice. But I feel like I'm the
You're
the
guiding
guide.
them. Yeah,
Yes,
absolutely.
yeah.
It's your job to be able to give them all the options.
Yeah, and did you think about this? Did you think
Yeah,
about that?
absolutely. That's fantastic. Tell me a little bit about your thoughts on HRT. It's fallen out of favor, in favor, and it's done it's done a full circle recently.
Yes.
So what are your thoughts on that?
It is so popular in the media right now, at
Yeah.
least social media, or maybe, I don't know, I guess they have my
Oh, they have the
algorithm.
algorithm, right? Yeah,
I'm on the algorithm, I guess.
yeah.
When I was in training, most residents, and I think it's important for our patients to understand that, like, when you come see your OB-GYN, especially if they're, around my age, we probably didn't get hardly any training at all in
HRT.
menopause treatment, HRT at all. And doctors that are older than me, they may have gotten the training, but then there was a very large study that came out called the Women's Health Initiative. And I believe it was around 2003, early 2000s. And it had some findings that really didn't match what the statistics said. Like, the statistics were kind of skewed.
Okay.
And so it led women to believe that hormone therapy is going to cause cancer, especially breast cancer, stroke, blood clots, heart disease, all kinds of badness.
Yeah.
And really, it's not true. When you look at the statistics, I won't go into it because I could open that Pandora's box. Yeah. But it went from where prior to this, it was hormone therapy was one of the top 5 most prescribed prescriptions, period. Like, 70% of women or so were on hormone therapy. And then it went to almost none.
Yeah.
And so I have come to learn, like, post-residency, that there are so many benefits of hormone therapy. And it's not necessarily needing to wait until you're officially in menopause, which the textbook definition is 12 months after your last period, because perimenopause can last for a long time. Some women have almost no symptoms, and some women struggle for a long time, even though they haven't had that last period. Yeah. And so introducing hormone therapy to treat the symptoms, which, like, the on-label FDA-approved symptoms uses are for treatment of hot flashes and also prevention of osteoporosis. Yep. But many women will tell you of the many off-label uses, and I think can really just sum down to, I feel like myself again.
Yeah, yeah.
And so really the FDA has been kind of cheating women for a long time out of a lot of health. And I think about my mom, because she's part of that baby boomer generation who I think was very much robbed of a lot of the health benefits.
And the consequences of that.
The consequences. 1 in 2 women will get a fractured hip, and we can prevent that by about 50% if you're on hormone therapy.
And I think you talked about the big ones. You haven't even talked about the small ones, like you mentioned, where women are starting to talk about themselves again, the energy level impact, just a general wellness. There's also a similar push for male hormone optimization. So on the other side of this, when you look at male hormone replacement, or TRT, it's got some negative media, negative marketing, all of that, but generally not, nearly in comparison to what the women's hormones did, and how, there was a big phase of actively, suggesting nose usage. So now it seems like there's been more of a push of what's considered hormone optimizations, and not necessarily just normalizing level, trying to get them to where it starts to make you feel better.
Right.
Because, hormones don't have to be a certain number that makes sense to every single patient. You could be at a different level as an individual. Right. And so trying to find that balance is critical. And I'm guessing when you all do HRT, it is patient-based, based on their size, their age, their, other areas.
It's not a dose like, oh, this is your body weight, so this is your dose. It's not a one size fits all like that. Yeah. And also bringing up male hormones, there's not an FDA approved product for women for testosterone.
Oh, yeah.
Even though it is FDA approved to use testosterone for women for low libido.
Yes.
So even though we know that it actually is the major hormone, like, we as younger women have more testosterone coursing through our bodies than estrogen.
Yep.
And it's always been considered a male hormone.
Yep.
And so it's kind of unfair that, we aren't given the same opportunities to treat. So we have off-label use of men's testosterone that we try to give at a female size dose to optimize. But also speaking of the testosterone, the dose can, you know, not just estrogen as well, but with testosterone, with the sex hormone binding globulin, you may need a much higher dose to have any effects.
Absolutely. So being able to do that, I think at this point is fantastic, and that it's customized to the patient's needs to try and get them the best outcome. I think that trend's picked up, and I'm glad that it's doing that, because I feel like you mentioned, we skipped a whole generation of people, and that's really unfortunate. So on the HRT side of things, what are the different ways to have that hormone replacement therapy done for women?
Yeah, absolutely. So personally, I offer like FDA approved options for patients, but there are compounded options as well. I know a lot of women use pellets. My colleagues offer like the pellets, the BioT. And so lots of things on the menu for women. I think some of the most popular are the transdermal options. So there's oral estrogen therapy, but when you take it transdermally, it really bypasses the first pass liver effect. And so you have a further decrease in some of the potentially harmful effects, like an increased risk of stroke, blood clot. So it is safer for more women. And also it has a steadier state. So like a patch, for instance, they offer pretty small little patches that you stick on your skin, and you change it twice a week. And so that steadier state can avoid like the fluctuations that, especially in perimenopause, some women are dealing with the ebb and flow.
Massive ups and downs. And then it seems like there's many options if they have a particular, they want patches, they want a long-term pellet option, they've got all sorts of options to consider.
Right. And so the benefit of the ones I give are they are often covered by insurance. So that's
as compared to pellets.
As compared to pellets. And like the companies that provide the ones that you can get at your regular pharmacy, not compounded, you're going to have a very reliable dosage with them because they're mass produced. I did bring one just to kind of show, because not only are there patches, there's gels, but I think this one is really neat. This is called FemRing. So they actually have a ring that's like a very low dose. That's like the low dose topical estrogen, like you would give for like a cream or a suppository, which I'd like to touch on that more in a minute.
Sure.
But this one gives the same amount of hormone that you'd use for like a systemic hormone therapy. But it also, I tell patients it's like a twofer because it gives you that vaginal local estrogen hormone as well. The one downside on this is insurances aren't perfect at covering it yet. So with the manufacturer coupon, it tends to be about $180, but for 3 months.
Okay, that's good.
So it's like 2 prescriptions, $60 a month.
So just to touch on that twofer effect, you said it's vaginal estrogen. What other, what's the other impact of vaginal estrogen? What are we covering with that?
Great question. So when we're giving this, hormone replacement, which really the preferred term now is like menopause hormone therapy, because we're not giving a full replacement value necessarily, although there's some discussion about optimization to make you feel good. But usually those levels aren't high enough that they would significantly impact the tissues in the vagina. And there are so many hormone receptors in the vagina and also like the urethra and the tissues at the opening of the vagina. And so by having that estrogenation there, it improves like the vaginal moisture, just the elasticity of the skin. And it's primarily, many women know it as helping with decreased pain with sex. And like that, a little vaginal dryness, but that's really missing a huge point, because it's so important for like the health of the tissues. As we get older, those tissues shrink. You can actually have disappearance of the labia minora, the tissue over the clitoris, like the opening of the vagina can become very small. Even if you're still sexually active. And that's part of what can make it very painful. But also importantly, women can experience urinary tract infections. And the vaginal estrogen helps promote a healthy microbiome that helps prevent the invasion of bacteria. And so urinary tract infections are probably the number one cause as people get older of being hospitalized. And so it can actually save lives
Yeah.
if you're, using the vaginal estrogen. So I fully plan on being on it until I die.
That's fantastic.
Once I start
Well, that I guess it's as high as you can go in terms of advocacy for that. So that's fantastic.
Yeah.
I know we talked about some products that you hate and some that you love, and so you brought a couple of things.
I thought it would be fun.
So let me
Girly show and tell.
grab these and put them up right here. And
We'll see if you turn red.
all right. No, I think let's see. So tell me about these.
Yeah, absolutely. So let's see. We had talked a little bit about the incontinence issues before, and I think this is a great one for women to know about. This is help. It's called Poison Pressa Bladder Supports. Poise is a huge brand that I think women are familiar with their pads and such. That they used to sell this in the stores, and not anymore. You can only get it on Amazon. I'm not sure why, but if you have occasional leakage with like cough, laugh, sneeze, this is what you need. You first buy the sizing kit, and then you decide which size is right for you. And then I'm going to have you open this so you can see what this is like. Let's see. So it looks kind of like a tampon applicator.
All right.
Feel free to take that out of the package.
All right. And you said you could first get a sizing kit. So is that something pretty easy, intuitive for patients to be able to do themselves?
Yes. Yeah. The sizing kit is a smaller box that has, I believe they have 2 each of each size.
All right. Okay.
And so then you start with the smallest size, and then you go to the smallest size that controls your
slight
slopes.
trial and error.
Exactly.
All right.
And so this, again, is a tampon applicator. And if you needed some lubricant for placement, you would, and place vaginally. And then you insert. And then what pops out is this little cloth covered, with a string for removal. But on the inside, I've actually never opened this for show and tell before. So pardon me if this is hard to get into. But it looks kind of like, did you ever play Jacks when you were a kid?
I did not, but let's see.
Is it making me sound like a grandmother? So it's like medical grade silicone, soft and flexible.
Yeah.
And so it helps to support the urethra. So when you're coughing, laughing, sneezing, you're not leaking urine and peeing all over yourself.
Okay. That's
so
fantastic.
I can, sorry if it's TMI, but I can personally attest to when I get bronchitis about once a year.
Sure. No, absolutely. This seems very easy to use. And it's a pretty common complaint that you often get with stress incontinence.
Yeah.
So this, I'm assuming this is not terribly expensive either.
No, they cost less than $2 a piece.
Okay. And how long does this thing last?
So you can leave it in place for up to 12 hours at a time. Yeah. So you can leave it in place all day long and use, like one a day. But if you're needing to use this every day of your life, you really need to come talk to me about some other things. But it's a great temporizing measure for sure.
Fantastic.
I was going to say on the other side of the coin, things I don't like are some of course, what Poise even makes is some of the incontinence products, or even that women use for like just kind of daily feeling like clean, panty liners, or just wearing pads all the time. I find that a lot of women, especially if they have moisture from discharge or incontinence, here's a little for disposal. Be sure you don't flush it in the toilet.
Oh yeah, right. Save the environment.
So that it acts kind of like a microfine sandpaper against your skin, and especially if there's moisture there. And so it can cause so many vulvar problems. Yeah, and also you can actually get more discharge. Some women wear panty liners to prevent discharge, and the irritation causes more. Yeah.
Okay. I think you brought this as well, Lisa.
I did.
This is one of the ones you love.
Yes. Perfect. Yes. I love boric acid, vaginal suppositories. So this, I don't know if I like this brand. I frequently recommend it on Amazon. It's called Pelvana because I noticed the price is much less than things that I've looked at. I like to look at the
actual cost of the patient.
Yeah, the cost and HEB and such. But these are capsules that you place in the vagina. I will kind of show you because I think it's important. And I do always tell my patients, it looks like something you'd swallow, but it is harmful if swallowed. So I say keep out of reach of kids, pets, and covers that may perform oral sex on you.
I think that's important to have that information. Yeah.
So if you're intimate, then you could place it like after intimacy, and then like you should be okay by the next day. But
And so this is a daily vaginal suppository?
So it comes with applicators, and this is something for my women who, like, for women that have recurrent bacterial vaginitis, this is a game changer. If you are maybe just getting the slight like yeast infection symptoms, like this can often help nip it before it gets out of control. So it helps to create the ideal vaginal acidic pH. And so that helps support the growth of the lactobacilli, the healthy bacteria. And then it helps discourage the overgrowth of the other players that we don't want. And then what I love about it is because it's not an antibiotic, and it just helps support your body doing its natural thing. It helps prevent that antibiotic resistance. And then also, if we give antibiotics for things, sometimes then you get a yeast infection.
I've actually never known a person who's got BV once. Like, if you see it long enough, it'll be BV once, and then you'll have.
It tends to come back and back. And actually, there's a recent study that came out because a few years ago, like you look up to date, and it clearly said there's no benefit in treating a partner. And you're just reminding me, this came out about a month ago. I believe it was New England Journal of Medicine. I forget the name of the trial, but partner treatment for recurrent BV is helpful. And so treating the partner with, I believe it was doxycycline for a week plus clindamycin cream applied to the penis nightly.
Has shown value.
Can, for some of those women that cannot get rid of it.
Okay, well, that's fantastic. So if, let me get these out of the way, and then I'm going to ask you follow-up questions.
And then I was going to say, on the other side of the coin, what I do not like for yeast infections. So over-the-counter, like, it's lovely to have over-the-counter treatments for yeast. And, patients that go and they're miserable, they're going to go look on the aisle and see, like, have a choice between, like, 1, 3, 5, or 7 days. Well, obviously you're going to pick the 1-day treatment because you want to feel better fast, but please don't do that. Please get the 7-day treatment because when your vulva and vagina is very irritated, it's like pouring gasoline on a fire. 1 day is just, it burns. It's very uncomfortable, very irritating. So 7 days better.
Fantastic. So for a young person, for a young female looking for contraception, is there a default best option? Is there something that you would recommend?
Yeah, again, I individualize it because I strongly believe, like, your body, your choice. But oftentimes my younger women are looking for something that's convenient, that maybe they don't have to think about every day. Frequently, this time of year, ladies may come that they're about to go off to college for the first time. And, your life may not be, you're always flying by the seat of your pants. So I think oftentimes a long-acting reversible contraception, something that you don't have to take a daily pill to think about, is helpful. I had one gal I was talking to about it, and mentioning that, in this Texas heat, like, you shouldn't really be keeping your pills like in a bag in your car because they may not be as effective.
Oh yeah, absolutely.
Yeah. And so, not only are there pills, which are very effective if used perfectly, but nobody's perfect. There's the IUD. The Nexplanon is a very popular one that lasts for 3 years, placed under the skin of the arm. And then another one that I like a lot is the vaginal ring. There's 2 different options, NuvaRing, and there's one, sometimes I call it like NuvaRing 2.0, because Annovera, what I like about it is the one ring lasts a whole year. So you don't have to worry about getting refills at the pharmacy or anything. And so it actually is placed vaginally, and you leave it in place. There can kind of talk about the on-label and off-label placement of it, but it's so convenient. It actually looks just like this, and the patient can place and remove it herself.
Perfect. That's fantastic. So we know how to get, patients to come and see you, but if there's anybody watching that doesn't come through us, where can they come find you? Where's your clinic? And, for the general San Antonio market?
Yeah, absolutely. I'm at Riverwalk OBGYN, or Riverwalk Women's Health. We are centrally located in Castle Hills on West Avenue. So easy to get to us from about 15 minutes from anywhere in the city.
Absolutely. All right. Well, this was fantastic.
Yeah,
I really appreciate you taking out the time. I think this is the most information I've gotten in all of the episodes we've done before. Because, I think gynecology is its own field. As internists, as internal medicine, we cross-train in cardiology, pulmonary, GI. We don't really do that much gynecology and OB. So I feel like that's it was very refreshing and also very informative.
Thank
So
you.
I appreciate your time,
It
and
was fun.
hopefully we'll get you back on here, and
Yeah, I'd love
and
to.
we'll go from there.
I'd love to.
All right.
Yeah, thank you.